It's not as if she needs a reminder, but here are the photos anyway. Hair growing back post-chemotherapy, the scar left after surgeons cut through Rachel Carney's back to remove a tumour from her esophagus.
The only symptoms that I had were severe acid reflux. It came on very quickly.
Rachel was unlucky on a number of levels, not least this cancer of the food pipe is more common in men over 60. And like 20% of cases, hers was only picked up in A&E.
Obviously, to a good degree, I was in shock because I just was baffled by the fact that I had this diagnosis. But my treatment plan was chemotherapy, followed by an esophagectomy, which is basically the surgery to remove the tumour, and then followed by a final treatment of chemotherapy.
Currently, anyone suspected to have the cancer has an endoscopy, a tube put down their esophagus.
So today I'll be performing the breath test.
But now a new trial is underway to detect this cancer using a bag of breath. A gloriously simple and easy to use device.
Thank you very much. That completes the breath test. Thank you.
The tube containing the breath is then analysed in a laboratory. It detects volatile organic compounds, which are small gas molecules, and early results are promising. It's been 15 years in development here at Imperial College London, and if successful could revolutionise tests, not just for esophageal but other hard to detect cancers like pancreatic, gastric, colorectal and liver. These trials are also underway, with 25,000 patients being recruited.
This really will address the balance of testing people with non-specific symptoms. If it is positive, we'll refer for endoscopy and camera examination. And if it is negative, then patient have a medical treatment and retest again if the symptoms persist. So it's a triage test in a very similar way to the stool test for colorectal cancer.
There are 9,300 cases of esophageal cancer in the UK every year, and sadly, because it's so hard to detect, it has a 16% survival rate.
We need to focus on those things that will bring patient benefits sooner. And I think that the bags of breath, if we could know that that was available at a GP surgery, that the public would know about it, it would make them present earlier. And I think it would be a less invasive and a cheaper way of us finding out, is there something in there that we need to look after?
The bags of breath concept is actually part of the future in healthcare, where testing becomes more accessible, less intrusive and less expensive. It's what is behind these new community diagnostic centres set up by NHS England, this one tucked between a Boots and a Primark in a North London shopping mall.
So we've got 3 ophthalmology lanes here and 2 X-ray rooms, and then as we go around the corner here we have 2 ultrasound rooms as well.
This one is run by the Whittington Hospital. And is it taking pressure off the hospital?
Yeah, absolutely. So 13,000 tests so far, with 60,000 tests per year when we're fully up and running. That means that these are tests that don't have to happen in the hospital, so that we can do other tests in the hospital and we can keep diagnosing cancers earlier and other diseases earlier.
The basement of this shopping centre is now being prepared to take a CT and an MRI scanner. There are more than 90 of these community centres now around the country. These community diagnostic centres are a work in progress. They're looking for spaces across England to build them. They are at the heart of the government's plans to reduce elective waiting lists, to take the pressure off hospitals and off GP surgeries. But the question, of course, is, will they work? Staffing will be an issue, with historic shortages across the NHS, although they have managed here. Rachel Carney is cancer-free, although on a liquid diet, and she has to have morphine patches. But supporting the bags of breath trial was because she wants others to be diagnosed faster. And should she be worried in the future, then this test could be there for her too.